Well, we're going to go ahead and get started. I'm really excited for the presentation today. Before we dive into that, I have a couple of just kind of housekeeping, general announcements on the Dewey side that I wanted to let these folks or you guys know about. Most of you probably saw the update email that came out this week, but two really interesting new data partners are now live on the Dewey platform. One is a weather data provider. So we actually have very detailed all the way down to the hourly level of weather readings for over 2,000 weather stations in the US going back to 2018. So that's now available to all Dewey subscribers. And then we have a little bit more of an interesting setup where we have a partnership actually with a company called Regrid, which is one of the leaders in real estate parcel data. And they have a data with purpose, they call it, academic program, where they like to provide data kind of similar to Dewey at low to no cost to academic researchers. And so we have a partnership with them. If you're interested in learning more, we have links through our website or through a platform to get introduced to that team to potentially get this parcel data for your research as well. And a lot of exciting data partners kind of in the pipeline that are coming soon. And so I'll keep kind of announcing those as they come up. But to get to the meat of the presentation today, I'm excited to introduce Dr. Aaron Yelowitz. He's a professor at the University of Kentucky Department of Economics, and he's also a joint faculty member at the Martin School of Public Policy, a research fellow at the Institute of Labor Economics, along with a lot of other things, a lot of other positions as well. Really excited to have Aaron today. He's going to talk through some of his research, which was done with his team, actually pretty early in the days of COVID. He was actually one of the very first SafeGraph users and was able to really quickly kind of spin out this research. And so this will be really helpful for folks who are continuing to use the SafeGraph data and dive in. And yeah, so I'm excited personally to dive in and learn more. Aaron, I'll turn it over to you and let you kick it off.
Thank you, Evan, for having me present to the audience here. I've been doing research on COVID pretty much since COVID began. Part of the research team that you see on this slide, my colleague Chuck Cordemanch, former graduate student On Lee, who is now at the FDA, and I are part of a team that wrote a paper in May 2020, so only a few months after COVID actually began, that used very early data on the spread of infections and looked at lockdowns, and our early work published in Health Affairs, which has been cited around 800 times or so, basically found that those social distancing measures, especially the closure of entertainment-related venues like restaurants and bars, and the shelter-in-place orders really mattered early on for the spread of infection. In that same paper, we found that the school closures that all pretty much happened literally, I'm looking at my date, 3 years ago today, like 3 years ago this week pretty much, was when the World Health Organization declared COVID-19 a pandemic. And we all remember 3 years ago, the world really did go crazy right around this time. And literally, we went from something like maybe schools in New York City and a handful of other places having been shut down to all schools essentially shutting down in about a 1 week period or so. Our May 2020 paper, and that was our preprint in May 2020, which got a ton of attention, which was ultimately then put into print in July 2020. Didn't find much effect for school closures, though what we were thinking was, maybe we simply didn't have much variation, since essentially all schools throughout the US, with only a handful of exceptions, like very small, non-dense geographic areas, since they all pretty much shut down at once, we just didn't really have the variation to tease out subtle effects of school closures on the spread of COVID. Okay, so in that early paper, we found that some measures mattered for the spread of the disease, but not others. And school closures, we found, didn't much matter. And part of the reason for that might be because we simply didn't have enough variation across the 50 states and the 3,000 some odd counties within the US. So one of the papers that then followed from that was, and again, we all have to remember back to what 2020 was like, which for most of us, the past few years have been a blur. But remember in 2020, we were living in a world where it was uncertain of when vaccines would come in. Vaccines didn't actually, right, the kind of wonderful discovery of vaccines for COVID didn't actually really kind of hit until December 2020. And of course, at least at the beginning, there was excess demand for vaccines. And so it was really layered out where the most vulnerable got the vaccines first. But we then basically are looking in a world prior to vaccines being available and where therapeutics were largely not terribly effective at the time, or where we didn't have the kinds of therapeutics that we might have today. And we were looking at some states that many states had closed their schools, but then come fall 2020, so a few months after, 6 months after COVID had started, in some states, schools were starting to reopen, and then in other states, they would stay closed for a considerably longer amount of time. So we are looking at one of the early implementers of school reopenings, which was Texas, and we're looking in a pre-vaccine era and in an era prior to terribly effective therapeutics. And what I'll do mostly in this paper is emphasize some of the real value added of the SafeGraph data which at least part of the data which is not really being updated anymore, the social distancing metrics data, but nonetheless was highly useful in us trying to learn about some of the mechanisms through which school reopenings could matter for the spread of COVID-19. So basically, many thanks to my research team, and I'll proceed on to just give a little bit of a refresher on what the world was like in fall 2020, and then where the SafeGraph data really comes in, and then happy to answer any and all questions that I can. Okay, so it was well known from the beginning of the pandemic that there were real concerns about school closures, real concerns about student learning loss, real concern about, for example, frazzled parents, about the idea that schools serve many purposes besides simply educating kids, for example, keeping track of kids who might be in vulnerable or at-risk situations. So there's lots of concerns about the benefits or the concerns about school closures, and then the benefits of reopening in terms of improved learning, social and emotional development. But then there are also concerns about reopening schools, mostly from the spread of the disease. And basically, many of us are familiar with the arguments on children generally, if they get COVID, tend not to get terribly severe cases of COVID. That need not be the case for the teachers who are teaching them, who are often considerably older and perhaps more vulnerable. And then perhaps concerns about, well, how many documented cases do we actually observe in schools? So basically, there's a question of how much is COVID actually spreading in schools, how much of that could be mitigated through things like mask wearing and so forth. But we were looking at a time when reopening of schools was front and center within the debate. We focus on the state of Texas for a couple reasons. First off, it turns out that Texas is obviously a very big state. It's a diverse state in terms of having both dense urban areas and also extremely rural areas. We're largely going to look on a county by county basis. It turns out that there are lots of school districts in Texas, more than 1,000, that are spread across the 254 counties. You'd imagine that some counties, for example, Harris County, which is where Houston is located, is going to have quite a few school districts, and then some of the rural counties are essentially going to have one school district. Texas was perhaps unsurprisingly, Texas and Florida are often identified on one side of the reopening debate, and then New York and California often on the other side of the reopening debate. Texas, Florida were both fairly rapid in reopening their states after the initial public health emergency. And so there was a strong push from the state governments for schools to reopen. And essentially, schools were allowed to start online, but basically they had to open up pretty darn quickly. And most of them did open up pretty quickly. I'll show you that in just a moment with a picture. But basically, we could also then characterize what does it mean to reopen schools. Did they, for example, have staggered or phased in attendance? Did they essentially reopen business as usual without masking? And in Texas, what one would characterize as school reopening was essentially kind of bringing kids, by and large, back into classes, largely without any mandates on masks. So this, in a sense, is a test case for perhaps very aggressive school reopenings as of fall 2020. Obviously, even in the most progressive states, that's what the world is now, but it was quite different back then. So what we do is we show that school reopenings actually did increase the spread of cases. So we're going to use the traditional economic approach of staggered reopenings across different geographic areas, the 254 counties, and look at how cases spread across those areas and how fatalities spread across those areas. But then this is where really the value added of the SafeGraph data, and I believe the contribution of our paper really comes in. In a sense, gathering information on cases and fatalities and looking at staggered openings is fairly common within the economics literature. It's the kind of standard difference in differences approach. Where SafeGraph comes in is perhaps allowing us to parse out why that might be. And fundamentally, how do we reconcile the many studies that show, first off, kids, the spread among kids seems to be pretty small, perhaps because they're asymptomatic sometimes. For example, when one of my kids got COVID, she was actually asymptomatic. We didn't know about it other than sort of testing in a precautionary sense because we were having my parents come to my house. But basically, even if kids are asymptomatic, clearly there is not nearly as much concern about fatality. So how do these results arise, and how would they arise so quickly, given that we would think that if COVID were spreading, it would spread probably from kids to other kids, and then to to middle-aged adults, and then perhaps spill over into more vulnerable adults after that. So it seems like it would take some time. One of the answers, which almost any parent could probably reflect on, is schools do more than educate kids. What they do, and what probably drove lots of parents crazy during the kind of lockdown, during the school closures itself, is schools serve as a babysitter in some respect for those who are in, say, K through 12, right? It's essentially free, in addition to educating your kid to some degree, it's also free childcare. And basically, when the kids are at school, it offers adults far greater opportunity to go out and live their lives in various ways, socially or whatever, during kind of 8 a.m. to 3 p.m. and as well go back to the workplace, right? So both of those sorts of mechanisms potentially would show up in SafeGraph data in terms of adult mobility. SafeGraph social distancing measures have really valuable metrics that will allow us to tease out those sorts of effects. And when adults interact with other adults, then we think the disease could spread, even though that's not literally within the walls of the school itself. Now, that is a school effect, in the sense that schools are a bundle of characteristics, both educating kids within inside their walls and serving other purposes, such as free childcare, which then in turn might spread the disease outside of the walls of the school. You wouldn't know that without the safe graph. And so this is where I see A, the contribution of the safe graph data, B, some of the richness of the safe graph data allows us to tease this out in incredibly convincing ways, in my view. For example, safe graph data looks at mobility on a day-to-day basis, which allows us to see how does mobility change on Monday through Friday relative to Saturday, Sunday. Our guess, which is then supported in our empirical results from the safe graph data, is school reopening should matter from Monday to Friday in terms of adult mobility. They shouldn't much matter on the weekends. I mean, clever economists can come up with stories why there might be very modest spillovers, but to a first approximation, do we see mobility in the safe graph social distancing measure data increase on weekdays, but not on weekends? In fact, we do. So that's going to be strong corroboration of our thought process here. So let me get through just a few minutes of other contributions of our paper. In a sense, any study that looks at school reopenings has to confront the idea that the typical economics approach of looking at the staggered openings over time runs into the issue that school districts are not necessarily a terribly coherent geographic concept, right? So in, there are many counties that collect data on COVID cases or on COVID fatalities. You're certainly not going to get that at very fine-grained detail below the county level. 3,000 counties is pretty good. You're not going to there might be a handful of states where they actually then disaggregate COVID cases or COVID deaths at the sub-county level, but not often. Many states would publish it at the county level. But the problem then with the county level is you think about big counties, the ones that would house, for example, Houston or Dallas or San Antonio, you're going to have a whole bunch of school districts. They're not just one school district. So what does reopening mean? And then basically, to what extent did Texas diverge from previous years in terms of reopening schools? What this picture is showing us is largely come fall of 2020, most school districts within Texas actually opened pretty much the same week that they did the year before. So we're able to look at a variety of data sets to try and look at 1,000+ school districts across the 254 counties. And most of them are opening up kind of business as usual early on. Of course, the ones that are massively delayed tend to be a little bit larger. So for example, some of the big school districts would be delayed considerably by a few weeks. And so basically, that gets a little bit at this issue of endogeneity, where school districts may not be reopening because cases are really bad in an area. But largely, schools were doing what they were doing the year before, kind of business as usual in Texas. So we gather up 3 different sources for COVID and school reopening information that are independent of the safe graph data. So from State of Texas Department of State and Health Services, we're able to get a count of cases, fatalities, and testing on a day-to-day basis. We convert that into weekly data and then scale it by the number of residents so that we're getting rates of cases, fatalities, and tests. We're able then also to link schools. And basically, we're going to use that for the most part to try and parameterize when did a county open. And basically, the way of thinking about it is, imagine we have both very small school districts within a county and then very large school districts within a particular county, right? So the idea that the geography of COVID cases, which is presumably what we care a lot about, right? Just the spread of the disease and fatalities, isn't overlapping all that well with this kind of nebulous idea of a school district, which doesn't have to correspond very well to geography. Big districts should matter a lot more for the spread of disease than small districts. When we return only a small number of students, it shouldn't much more. So we basically then, almost on a case-by-case basis for each school district, through Google searches, looking on Facebook, trying to call up and figure these things out, figure out the precise timing of when school districts reopen and the modality. And so the real issue that we run into is, how do you characterize reopening? For example, there's a study from researchers at Tulane University that basically define reopening when the first school district within a county opened up. But if those school districts that tend to open up first are relatively small, then in a sense, it looks like the district reopened, yet if only a small number of students are in the first week or two initially returning to school, we may not see all that much in terms of the spread of the disease or fatalities, those sorts of things. And about 33 of the 254 counties have multiple school districts, and it would come as no surprise that those counties would tend to be the relatively large ones. As an example, think about where San Antonio is located. It has 15 school districts within Bexar County, which is where San Antonio is. The very first school district that reopened was Southwest Independent School District, opened up on the week of August 24th, 2020, but represents less than 5% of county enrollments. And the last one didn't open up until 7 weeks later. So the sort of nuts and bolts issue that any empirical researcher has to run into is, when did San Antonio or when did Bexar County reopen? And then how do we associate changes in COVID cases and changes in fatalities with the school reopening? So this kind of illustrates that kind of conundrum. Turns out that during the week of September 8th, 2020, 6 districts opened up for in-person that represented about 75% of the student population. So in a sense, there are, what you might imagine, among these 15 school districts, some that are pivotal in terms of saying lots of kids are now going back from their house to in-person school. So what we're going to do, we simply take a stand, and this is highlighted in red. The week in which the percentage of students who are back in school, according to scale by the number of pupil enrollments in school districts, reaches 50%, we're going to say you're open. Now, notice there is, of course, a little bit of slippage before that. In the weeks prior to school reopenings, there's at least some dose of reopening. So the first district typically opened about 2.5 weeks beforehand. So some of the actual true effect of school reopenings on spread of disease could actually happen before we're saying that in a sense, the policy is turning on. Now, let's get to the SafeGraph data. Just to recall, since there are a variety of SafeGraph data sets that are out there, the one that I think is probably most used today would be the point of interest data, where essentially, and Evan, correct me if I'm wrong, something like 5 million or so points of interest are followed. We see foot traffic on a day-to-day, even an hour-to-hour sort of basis. So there's all sorts of interesting things that one can do with that. Early on in the pandemic, although I think this ended sometime in 2021, SafeGraph was also, in a sense, characterizing mobility in ways that were conducive for thinking about the spread of COVID and for lockdowns. And that's what we're going to focus on here. Our window in Texas for looking at school reopenings exactly coincides with when the social distancing metrics data was actually able to be used. So little information that I'm sure people on this call can check me on in whatever ways my numbers are outdated, but SafeGraph collects data on about 45 million devices, which is about cell phone devices, about 10% of all devices in the US. So pretty robust sample. The sample correlates highly with true census populations with respect to distribution by county, educational attainment, and income. So in the world circa 2020, we don't think that there's anything terribly unusual about people using smartphones that, in a sense, track them compared to the population as a whole. The data are then aggregated from GPS pings by cellular devices that have opted into location sharing services from smartphone apps. And then here's where lots of the beauty of the SafeGraph data comes in. Essentially, SafeGraph is able to determine your home census block group. So census block groups are incredibly refined areas. So just to give some perspective, census tracts, which are often used by economics research, there are approximately, if memory serves correctly, about 70,000 census tracts throughout the entire US. There are about 3 times as many census block groups. And then there's actually a categorization that is even finer than block groups, which is called census blocks. And there are something like 10 or 12 million of those. But think about 220,000 or so census block groups across the entire US. And essentially, for any user, we can figure out which of those 220,000 census block groups is their home block group. So each of us with our cell phone, essentially where we're sleeping at night will determine our census block group, our quote unquote home in some respects. And that's then what is used to then figure out, are you in your census block group? Are you very close to where your actual house is? And then how often are you outside of your house? These are the kinds of social distancing metrics that were used in 2020 and 2021. So in our time frame, there were about a little more than 15,000 census block groups within Texas. And again, remember, about 220,000 across the entire US. And from my tabulations, on a typical day, there were about 1.9 million devices that were followed within Texas, which makes a lot of sense. If there are something like 45 million across the US, Texas is a big deal. What we're then going to do is, because some of the block groups have a very small number of devices, and perhaps if you stop using a device or if you opt out of apps, we kind of lose you, that kind of thing. We actually restrict the sample to most of the block groups, about 14,580, where we're following them continuously on every single day. So, and the typical census block group that we follow has 112 devices. So basically, a lot of the numbers will be getting, like minutes outside of the home, or the fraction who are completely at home, are actually constructed using, fairly large samples of devices. Now, I'll show you a handful of information real quick. It turns out that the places that tended to reopen on time tend to be somewhat different than those that didn't open up on time. So basically, for example, those that tended to delay reopening tended to have a lower Trump share. So imagine the more progressive counties within conservative Texas, where Houston or other large urban areas are, tended to reopen later, and also, at least politically, kind of were different. But other than that, we're not terribly different. So in a sense, the biggest difference in terms of why districts were reopening or not tends to have to do with political affiliation. Don't know that that should come as much of a surprise in the year 2023, that's how lots of these policy decisions were made. But part of the emphasis then is lots of the policy decisions really weren't made by the conditions on the ground at the time, but rather based on sort of core values about the fear of the disease and the seriousness of the virus and perceptions of it. Okay. So what we're going to do is estimate event study models. And essentially what we'll do is we will look before and after school reopenings, where again, we're characterizing characterizing a county as reopening based on whether the number of students who are back in school is at 50% or higher. And essentially, we will look at 8 weeks after school reopenings and 8 weeks prior to school reopenings. And again, and then we control for some other stuff, for example, baseline testing. Even in 2020, and this is again a little bit hard to think given the at-home tests that we have in 2023, and in a sense, the kind of waxing and waning of free testing and drive-by testing and drive-through testing, those sorts of things. But testing was still relatively scarce for at least part of 2020. So controlling for tests, because, and many of you are, I'm sure, aware, acutely aware of early in the pandemic, we suspect we substantially underestimate the spread of the disease because there was just no test to actually figure out whether people had COVID or not. So we control for things like testing in here. We also have county and time fixed effects. So one might imagine that certain weeks during fall 2020, like Thanksgiving break or Christmas break, that comes a little bit later, obviously, will matter as well. I also noticed that Evan talked about weather data. We control for weather in here as well. Texas is a big state. We tend to think of Texas as warm and balmy, but basically across a very large landmass, we're able to get average temperature and precipitation, and that will matter a lot for whether people are inside or outside, and those sorts of factors could independently matter for the spread of disease. And the fact that Texas is, just a large state, not in terms just of population, but in terms of land mass, means the weather in some parts of the state will be different than in other parts of the state. So we try and control for that in many of our regression specifications. So part of what I'm showing here, and this is not safe graph data, this is basically showing a bit of how school reopening, which we're characterizing relative to the period right before reopening at -1, how school reopening matters for new cases standardized by number of residents. So what you see from time 0 onward in those 8 weeks, an increase in the number of cases after school reopening. And the reason why we have that dotted red line is, again, our view that, in a sense, this quote unquote opening variable is a bit contaminated by the idea that there was sort of a gradual reopening over several weeks prior to what we're calling reopening. And what we largely see is that there was no obvious trend in cases prior to reopening, but then cases go up after school reopening. So this, again, doesn't have anything to do with the safe graph data per se, although the safe graph data will inform us about why we might see a rise in cases after school reopenings, given that there's a fair bit of evidence that there's not a lot of spread of the disease within the schools themselves. And then we also look at fatalities. And again, here you see that fatalities are going up in the weeks after school reopenings as well. So imagine that part of what we're trying to motivate for the spread of the disease here is, why in the world will we see that school reopenings at time 0 would significantly matter for the spread of disease, say 3 weeks later? So you start to see that starting at week 3, we get statistically significant increases in the spread of disease. And the answer is going to be, the answer is going to be arguably that it's not just the spread of the disease within the walls of the school itself, but also adult mobility. So there are reasons perhaps to think that there's in-school spread, right? And we've calculated that, and it's not unreasonable to think that there's spread of the disease and it would start at kids, go to the parents, and then go to vulnerable elderly people or something like that and lead to fatalities. But there are other reasons as well. And the safe graph data really does inform us on that. And so I'll show you some pretty pictures on this. So first off, we think that schools are like a babysitter. They reduce childcare costs, and this should matter Monday through Friday, but it shouldn't matter on Sunday and Saturday and Sunday. And then the second argument is, even for those without kids, there might be a signal when schools reopen that life is getting back to normal, and whether interpreted correctly or not, this should perhaps essentially matter. So if you start to see the activities that were halted in March of 2020, literally 3 years ago this week, if you see those going back to normal, then basically we might see a return to other sorts of activities that then, in a sense, kind of playing off of the signal about, well, schools are reopening, so things are getting back to normal. And that potentially should matter on weekends as well, right? So it's, so let's see what we see. So this first off is us characterizing the SafeGraph social distancing measure data, or social distancing metrics data. And here we're only looking 6 weeks pre and post. We think that mobility effect should be more immediate. And so again, this is standardized to time -1. And we think that there might be some anticipation effects. It's not like school reopenings are a complete surprise, but they're anticipated a week or two ahead of time. So people may be prepping for returning their kids to school even beforehand. But what you see here is, for example, time spent completely at home plunges after school reopenings. And remember, SafeGraph data is following cell phones, not of kids, but of adults. And so basically, this is not kind of kids being in school, but adults not being at home anymore. So time completely at home essentially drops off pretty darn quickly and stays lower afterwards. Median non-home dwelling time, so the minutes you spend outside of your home, goes up significantly immediately after school reopens. That's the upper right-hand side. And then what you see is both a return to what you'd call part-time work and full-time work after school reopenings as well. And so an interpretation of the full week results, which we're scaling from Monday through Sunday, and you'll see why we do it in that way in just a second, is that it looks like essentially adults are becoming more mobile. They're both returning to work and they're just getting outside of their home more. One could argue that those are reasons why COVID would spread faster with school reopenings, and they are due to school reopenings, yet they are not occurring within the walls of the school themselves. Now, what I find to be the most compelling way of using the SafeGraph data then, given that the SafeGraph data offers daily measures of mobility in their social distancing metrics data, is this is us looking at aggregating the Monday through Friday results to a weekly level. These patterns are essentially identical to what you saw in the previous graph, which is not terribly surprising since it's 5 of the 7 days. But then, right. So in the sense, you see time completely spent at home plunge after schools reopen, median time spent outside of the home increase after schools reopening, part-time, full-time work increase quite a bit after schools reopen. Smoking gun, however, then will be the next picture. This is weekends. Now, weekends inherently should be less precise, right? They should be less precise because we only have 2 of 7 days. What you see is time spent completely at home seems to be essentially unresponsive to school reopenings on weekends, which makes sense if you're taking kids to school and then going and doing other things during weekdays, but not on weekends. Median time outside of your home hardly changes at all. Full-time work doesn't seem to change at all. There seems to be something a little bit weird going on for part-time work. Could be that weekend activities are going up to some degree once school reopens as well. I don't know that we have a wonderful explanation for that, but at least my look at the weekend results are that they are largely unresponsive to school reopenings. Compare that to the weekday results, which are highly responsive in the ways that we would expect if school is serving as free childcare. So basically, our results then fly a bit in the face of what the conventional wisdom was in terms of school closures and school reopenings. There's a bunch of evidence, unsurprisingly, and it's not that we disagree with this in any way whatsoever, that school reopenings have real effects on kids, right? They really do matter for educational attainment, for how much is learned. for psychological well-being, all of those sorts of things. And the obvious cost benefit calculation that many economists were trying to think about would be, are the learning losses and other consequences on kids, in a sense, much larger than the spread of disease, given that kids are pretty robust, and even if they get sick, they're not going to get terribly sick from COVID. That's where the debate has been framed, right? And imagine we sign on to all of that. What it doesn't get at is this idea that school reopenings are more than just about the kids, they're also about the adults, and the spread of disease among the adults really could potentially change the calculations. So basically, I think that's where the SafeGraph data really does add value and changes the discussion to some extent. Let's see, some relevance for today. So one can ask, in the year 2023, what do we care about a pre-vaccine world, a pre-therapeutic world, those sorts of things. We probably don't think that school closings are anywhere on the table. We think kind of lockdowns are kind of dead at this point. People are over COVID for better or worse. We think that kind of the game changers, including vaccines, probably make that the case. Even with variants or surges. But basically, the results on the SafeGraph results on adult mobility may be the most important takeaway, which is schools matter for more than just kids, they matter for adults. And in turn, that also leads to other questions that one could look at with SafeGraph data, and in fact we are, which is, if adults are more mobile after schools reopen, that matters for things like economic activity, so not just kind of going back to work, but for foot traffic in various establishments. So those are the kinds of things that we're looking at now with point of interest data. Also, with point of interest data, one can try to infer across the entire countries when school reopens, in part because you can do this much more for high schools than you can for elementary schools, in the sense that SafeGraph will tend to follow devices from those age 16 and above, if I recall correctly, certainly 18 and above. And so you can see surges in devices within high schools that, like, so pre-pandemic, you'd see them. Then, of course, during summertime, they disappear. Then the year 2019, 2020 comes along, and you're going to see the devices in high schools Monday through Friday until March 2020. Then they're going to disappear. And then across various high schools, which are points of interest, you can then start to detect when did you see a surge in devices within those high schools again. And that in turn can allow you to infer in a very different way than we do by looking at Facebook postings and digging around on whether high schools, and almost by inference, whether all schools reopen. So let me stop there, and I'll stop screen sharing. And if there are any questions, I'm happy to entertain anything.
Thank you for the presentation, by the way. That was it was really interesting for me personally to dive into that and kind of understand the use case more. And I know we're getting close on time. I had maybe a comment almost more than a question. I just thought it was fascinating, the main takeaway being that adult mobility and the mobility of, the ones not inside the walls of schools is something that you can look at through, cutting and slicing the data in various ways. And so I'd be curious if you're thinking about, continuing along this research topic in various ways. And I think where I'd be interested personally is like how that, change in adult mobility, maybe changes over time with the perceived risk changing of various pandemics and stuff. Because I think that's, to your point, where it could really help us in future. So we're prepared the next time something like this comes around, and, studying it today when we do have things like vaccines and therapeutics and stuff. So I'm curious just to hear a little bit about your maybe future research topics that are relevant to this.
So future research topics, are framed partly in the sense that social distancing metrics data existed in 2020, disappeared at some point in 2021. So those kind of cool measures don't exist today, but what we still have today are good foot traffic data across a whole vast array of different establishments, right? And then what we also have from that point of interest data is we know what census block groups are, in a sense, like think of some establishment. We, safe graph data will allow us to know what census block groups the foot traffic is coming from. And although census block groups don't really give us details on individuals, it turns out it's unfortunate in terms of a commentary on US society, but it is fortunate in terms of learning about the world, I suppose, as an academic. It turns out that there's a lot of residential segregation within the US. So way of thinking about it is there might be some census block groups, the 220,000 of them or so, often are highly segregated. So some are almost exclusively white, others are almost exclusively non-white and so forth. With one of my graduate students, we're exploring, for example, certain points of interest like physician offices, where we can almost characterize a physician office, whether it seems to have a predominantly white clientele versus non-white clientele, and look at how foot traffic mattered during the pandemic itself, when there are surges in the disease within a particular area, and look at disparities. So in a sense, one can very cleverly use the information in safe graph data in ways that are more ambitious than even just looking at foot traffic, but trying to characterize clientele. Right. In a perfect world, one would know like it may be safe graph itself knows much more than we researchers know. But census block group, maybe safe graph has a much better guess of a cell phone device owner's income, right? Or they come up with decent guesstimates of that kind of stuff. But what you can do with census block group data, right? Income would be hard, but for example, trying to figure out from where you live, the kind of narrow area where you live, whether you tend to be white versus non-white. There are ways of connecting, for example, the American Community Survey, which has pretty good information on that kind of stuff, with block groups to make educated guesses on that kind of stuff. And so we're nowadays looking at establishments and trying to look at disparities based on the clientele, based on the foot traffic and the CVGs where they're coming from. So that's one thing that we're doing. And then also related to school reopenings, if adults are moving around in Texas after we reopen schools in Texas, presumably that happens everywhere, right? The kind of school is a childcare kind of model. And what that should show up in the point of interest data is then greater economic activity, perhaps during hours from 8 to 5 or 8 to 3 or something like that in terms of foot traffic. And so one can look at sort of stimulative effects of school reopenings on business activity, right? So that feels like a point of interest, the safe graph point of interest kind of project.
That's
so
great.
That's where we're trying to aim. As everyone who's going to watch this is well aware, right? Safe graph data is, big data. It takes a long time to actually kind of put it in the right form to analyze, but that's kind of where we're going with this.
Great. Yeah, you hear me taking notes. The idea of kind of joining some of these data sets with more demographic detail is fascinating, and actually something I'm exploring too in some of the data partners I'm bringing online, some in the healthcare space, but others in even like, transaction credit card panels that have better demographic data, obviously, than foot traffic may allow you to join these disparate data sets together and kind of glean some additional insights. So definitely a path I'm exploring when we kind of think about new vendors to bring online.
Wholeheartedly endorse that. That sounds
cool. Great. Got user number 1 right there.
Yes.
Awesome. Well, thank you so much. I know we're kind of over time already. I will say if anyone does have questions, feel free to either email me or post them in the Dewey community. I'll be sure to forward those and get those in front of Aaron so he can take a look and answer your questions as well, even after the fact. But thank you for the presentation. It was cool to kind of get in a little time capsule and remember where we were 3 years ago today.
Literally 3 years ago. 3 years ago, we'll get the date.
Yeah, exactly. Well, we really appreciate it. And thanks. I'll be sharing the recording too afterwards with everyone. So thank you again, Aaron, and we'll be in touch.
My pleasure. Thank you so much.
All right. Bye-bye.